Dr. Rahul Sarkar, who is working very hard right at this moment. I think you have just come from a 48-hour stretch duty over the weekend. He is a consultant intensivist and pulmonologist in Medway NHS Trust in UK, which is supposedly the epicenter of COVID-19 right at this moment and on the hot seat after Italy and Spain. And you guys are having a very, very tough time, I presume. Dr. Rahul.
Yes, it's an interesting time for overall medical community, and UK has been following the path of Italy more or less, and we are starting to get more patients of COVID-19, and we are learning how to manage these patients, and also we are all learning, more importantly, how to system-wise respond to this disease, which is coming with large number of patients at one single point of time. Therefore, the important aspect of this is not only just to treat a single patient, also to learn how to manage a large number of patients uh, from a single hospital point of view, and also across the health system.
May I ask you, Dr. Rahul, sorry to interrupt, may I ask you that how many patients at this time you are treating, both in terms of patients who are little stable, patients whom you have sent for home isolation, and patients who are very sick in ICU as well as ventilated?
So the numbers are varying across various hospitals. In our hospital, there are the increase numbers are increasing. Lots of patients are waiting for the results to be back, which is taking some time, and therefore, if we add the number of patients that are currently waiting to have their reports back, it will probably be double that number.
And anyone, the unfortunate people are on ECMO itself.
Uh, our center, ours is not an ECMO center. ECMO, so far in UK, we have 5 centers and we send them. We didn't have to send anybody to ECMO at the moment.
And what is the
But what's
situation?
happening is the general feeling and the national guideline is that ECMO hasn't been hugely great helpful in COVID-19. So I presume what will happen going forward is that the ECMO acceptance criteria will have a higher threshold of accepting those patients who are not
So
getting
they
better.
might come up with a, contrary to the H1N1, they might have a different threshold for the initiation of ECMO itself.
Yes, you'll probably will see that the more younger group of patients and no comorbidity at all, they will eventually be taken. What we
Okay,
have
so
seen
I will
clinically is that these patients have much stiffer lung, and they are taking much longer to
let me
recover.
interrupt you, Dr. Rahul.
And yeah,
Yeah, what I would do is that I will come point to point so that for our viewers and
sure,
listeners have a very structured view of what is
sure.
happening in NHS, and more importantly, the main intent of this video interview is to have a first-hand experience sharing and what we can learn from UK itself. Right. So I'm very thankful once again after such a brilliant and laborious job that you have come to for the interview itself. Okay. So first I
No,
will come towards the presentation. Right. In your experience, so you have must have had seen almost 30 to 40 patients. Some of them admitted, some of them not. They have been waiting for their investigations report to come up. So, if you may explain in a very shortly that what are the symptoms that is mostly presenting with.
they are mainly presenting with cough and mild shortness of breath for a day or two before it becomes worse, and at which point they are coming. That's the majority of illness. But as we have seen in literature, it could be many other things which we are not seeing that much, that myalgia or simply feeling very tired or some GI symptoms as well. The cough and shortness of breath are the primary two symptoms. Now we have very small number of patients. We also, what we have seen is that they go past their primary viral infection phase and they are presenting with bacterial infection, secondary bacterial infection. Say for example, purulent sputum and high CRP, etc. And that which would not really high CRP can happen at the primary viral stage, but purulent sputum you don't expect for the viral pneumonia to cause. So some patients can present with that as well, who are okay in the initial phase, but then getting worse later on. Mainly cough and shortness of breath, and they are in type 1
And
respiratory failure at presentation.
what about the fever? Is it conspicuously absent or a mild degree of fever is also happening?
Not everyone would be febrile. Some are, and it can be of a very variable nature. Some can have a fairly high degree of fever. We do Celsius, so 30, 38.5, 39 degree, which would be what, maybe 102 degree Fahrenheit, 101, 102, something like that. But you don't have to
And
have fever, especially in elderly. They can present with no fever at all.
okay, so fever may not be a very good screening symptom to on your based on your experience, we may
Yes.
say.
They can have a very mild degree of fever, but they are not always febrile. That's what we have seen.